Next matter, Devine. Senator Devine.
Thank you, Minister Guramagoth, for coming today. And I wish to take all that's relayed and discussed here today back to Minister Harris in this commencement matter for response. Sarcoma Ireland first met with Minister Harris in the first week of July of this year, and a commitment was given at that meeting attended to the group that a specialist sarcoma consultant would be recruited at St Vincent's University Hospital to look after the serious illnesses that they face. In the intervening period to now, there has been a lot of toing and froing between the Minister's Office, St Vincent's University Hospital and the National Cancer Control Programme. In essence, commitment given, and it looks like it hasn't been followed through with. I would like to acknowledge and welcome members of Sarcoma Ireland who came here on a last-minute notice to the public gallery, and I hope they will have more success through this commencement matter in getting answers from the Department and the Minister, who has ceased communicating with them despite numerous attempts. They have not even received acknowledgements. Minister, the following question has been put to Minister Harris in writing. I now put them to you for a response, and please carry them back to the Minister. Why the job description has no mention of experience in treating sarcoma patients and be actively engaged in research in this area? Why has a separate medical area of neuroendocrine tumours been mentioned in the job description? This is not related to sarcoma. Who is on the interviewing plans? No need to name names. The roles will suffice. And does it include an independent international expert on sarcoma who can assess candidates competently? Why has the position not been advertised publicly? The position has appeared only on their internal HR system and not publicly on websites that are frequently used by St Vincent's as well as the HSC and other hospitals. And can, lastly, they provide an assurance that 80% of the workload of the sarcoma specialists be dedicated to sarcoma patients? In essence, Minister McEntee, there was an agreement on the 6th of July for a new oncology post with expertise in sarcoma. The advertisement is completely watered down, and it wouldn't give you, I suppose, it would just didn't give you confidence that it's actually the post that these patients and Minister Harris has agreed on and is looking for. The sarcoma patients are extremely ill people. They ask simply that they be provided with the most experienced sarcoma specialist available. They do not believe that the current position advertised will meet their needs, and the recruitment process is fundamentally flawed. We implore that St Vincent's Hospital re-advertise this role and more specific candidate requirements, i.e. the stronger emphasis on sarcoma and experience and interest in the research in it. That 80% of the time of that oncologist post will be in treating sarcoma patients. Again, I want to thank the members of Sarcoma Ireland and have fought for months now to get the services they deserve. They cannot wait for more indecision on this matter. The current closing date is this Friday, and even at that, it could be at least 4 months before this consultant is in situ. Can you confirm this, Minister McEntee? It's been months since we got the promise, and now it looks like it could be at least 4 months before someone is in situ, given the prolonged process, perhaps, of interview and employment. Lastly, will you provide to me in writing the timescale involved in the interviewing, the recruiting and ultimately posting a consultant for this role, and written confirmation of how this is going to be implemented? I'd really appreciate it. Gura Mahagot.
Thank you, Senator. Minister.
Thank you, and just to thank the Senator for raising this issue, and obviously to welcome members of the organisation to the gallery today. I am taking this on behalf of Minister Harris. Obviously, there's a number of questions which you've raised, which I won't be able to answer, but I've taken note of them. I will bring them directly to Minister Harris and ask him to come back to you on it. I want to thank Senator Devine for raising this issue and for giving me the opportunity to update the House on the matter. As the Senator and many people know, sarcomas are rare cancers with about 220 cases occurring annually in Ireland. Services for patients with sarcoma are currently provided in St Vincent's University Hospital Dublin and in Cork University Hospital. Both hospitals are designated cancer centres and have an extensive range of multidisciplinary services and expert clinical advice available to them. A national clinical lead in soft tissue sarcomas is in place to oversee services for patients. Patients have their cases presented and discussed at one of the 2 sarcoma multidisciplinary teams, and members of these teams have links with European specialists in sarcoma. The treatment of sarcomas requires integrated multidisciplinary care with the involvement of many different clinicians. St Vincent's University Hospital has provided highly specialised and individualised treatment to sarcoma sufferers for a number of years. St Vincent's has access to all of the relevant specialities for treatment, including surgery, medical oncology, radiation oncology, radiology and pathology, and is the largest provider of surgical procedures for soft tissue sarcomas in the country. The HSC and the Department of Health are very much committed to providing a high-quality, responsive and sustainable service for sarcoma patients. To support the existing range of services for patients with sarcoma, an additional permanent post of consultant medical oncologist with a specialist interest in sarcoma has been approved for St Vincent's. The recruitment of this post, as the Senator has pointed out, is underway. It has been advertised both online and in the media, and I will ask for clarification if that goes any further than what has been outlined. And the closing date for application is the 27th of November. The job description for this position makes it clear that the post will provide a specialist service for sarcoma patients, and this will be a focus during the recruitment process. The Minister's Department and my department is currently working on a new national cancer strategy for the next decade. Services for rare cancers such as sarcoma have received considerable attention in developing the strategy. The strategy will aim to meet the needs of patients in the treatment of cancer and in improving their quality of life. Other areas of focus will include prevention, the early diagnosis of cancer and facilitating a patient input. The Minister intends to publish the new strategy in the coming months. In conclusion, on behalf of Minister Harris, I want to assure the Senator that the recruitment process is ongoing, that it will be concluded shortly. In the meantime, high-quality services will continue to be delivered by the multidisciplinary sarcoma teams, including the team at St Vincent's University Hospital. In relation to the interview panels, the independent experts, and obviously the time frame, whether or not it will be 4 months, I cannot answer those questions at the moment, but I will bring them back to the Minister and ask him to reply to you directly.
Thank you, Minister. Do you wish a brief supplementary?
Thanks, Minister McEntee. There's a lot of the questions that I did ask haven't been answered, and that's disappointing. I guess the patients for the past year or so, perhaps a bit longer, were very competently served by a previous oncologist with speciality in sarcoma, and that is all that they're looking for, is somebody with the expertise, interest and knowledge and research in it. At the moment, then, there was something rotten perhaps in the state of the health service, but certainly off-sided to St Luke's, which is not, from your response, a centre of excellence for sarcoma, but it only allows a consultant to take blood and give results, whereas previously it was an excellent record in St Vincent's Hospital of hands-on, modern, effective treatment. That's of real concern. It's to do with the inside politics, perhaps, of St Vincent's Hospital, which is a Shinshkele for another day. But I really need to impress on you the need to get an immediate answer to those questions, because obviously this is going to shut down on Friday. We don't know the timeline, but people then be invited for interview. The interviewing panel hopefully will consist of an expert, and how long that whole process will take, and if somebody is eventually chosen and considers and takes the post, then there's a delay in moving on from perhaps one job to another. 4 months would be a long time, although it would seem to me be realistic. Again, the patients are left in limbo as well, with somebody that is not able to practice what they have been practiced very effectively, and leaving them again between two stools, really, and I'd really appreciate an immediate response from Minister Harris.
Thank you, Senator. Minister.
Just again to stress that I will bring this to the Minister's attention. As the Senator said, people were previously looked after by somebody with expertise. I think that's the least that anybody should expect and will expect into the future. So I will bring all of these issues to the Minister and ask for a direct response.
Thank you, Minister, and thank you, Senator. Senator Batchik.